Why is a systems thinking approach to health and health systems important? I'm an ER physician and I'm on a journey to understand and transform our health system. I've been inspired by and really seen the value of viewing health and healthcare from a systems perspective for about 15 years now. So at its most basic form, a system is a variety of different parts and how they interact over time to accomplish or influence a certain goal. So let's consider a car, for example. A car has a variety of different parts, from the engine to the doors, and I don't know much about cars, but mufflers and other parts. And if you got the parts from, let's say, the engine from a Porsche, and then the carburetor from a Mustang, and then the body from a Volkswagen, all those parts might be outstanding in their own right, but they have to interact. The way they relate with each other is just as important, or maybe more important, than the parts themselves. And so the system is how the parts interact over time. Now, a car is an example of a complicated system. In a complicated system, there are a number of parts that interact, but they don't learn over time. So making a jet to go up to the moon would be an example of a complicated system. Baking a cake using a recipe is a little more simple, but it also has a recipe that you can follow each time. Complex systems, like health, are systems where the parts are people or organizations. And these people and organizations learn over time. They adapt. They have jealousies and assumptions and backgrounds and beliefs and errors. And so a complex adaptive system is a system with a large number of diverse parts that learn and adapt over time. And this is important in our health system because too often clinical medicine and even medical specialties within clinical medicine, in my case, emergency medicine, we focus on metrics and payment models that reward behavior within that subsystem. So I'm paid to see and care for more patients, not necessarily to make them better. Whereas in the university subsystem, professors are paid and incentivized to publish papers or receive grants, not necessarily to work with education and clinical medicine, public health, to make the community's health better. For me, this was a huge insight, and viewing health as a complex adaptive system allows us to put the goal of the system forefront, and then all the subsystems adapt to accomplish that goal over time. I'd love to know your thoughts. If you have any criticisms, comments, questions, I'm happy to continue to share with you about this idea.